Agent for the town of Falmouth, giving you a COVID update, the weekly COVID update. Today's Thursday, July 16th. And so let's begin. So if you reach us at our email is health@falmouthma.gov if you need to contact us directly. 508-495-7485 is our phone number. So jumping in, we've had 206 cases since March 2nd. That's plus 2 since 7/10, the last time I did this presentation. One is actually already out. It was an earlier infection. Wasn't quite sure why it showed up as an active case. It really seemed to appear to be a probable. But nonetheless, we're at 206 cases with over 98%, the vast majority, no longer in isolation. We remain around 13% of all cases in Barnstable, and we'll talk about it a little bit later. Barnstable itself, the county of Barnstable is also lower, has been low. Early in April, we were at 23%. We would expect it to be around 14, so we're around at the average. The VNA and the CTC, which is the contact tracing collaborative with the state, with the support of here at the health department, we continue to perform isolation and contact tracing on each case. So we've gained 2 this week, really 1, in my opinion, probably actually from the last 14 days or so. So we've been doing really well. Our weekly case trends show that our case counts remain low, again, at a peak at the end of March, early April, a peak again with some nursing home issues in mid-May, and since mid to late June, we've been averaging well under 10 and actually under 5 for the last few weeks. So we're doing quite well with our case counts, and it's very encouraging that we are, and that's great. Total cases, we've flattened out the curve, so to speak. Again, as of sort of mid-June, we've really flattened out around 200 cases total. After starting off really fast in early April, late March, early April, and again, a blip again in mid-May. So that's where we are with our new cases. The state dashboard is updated daily at 4 o'clock at mass.gov. So I get this is data from the state. Yesterday's data was 142 cases. It's been averaging about between 150 and 200, maybe 125 and 200. With 27 deaths, that's been averaging, I think yesterday, the day before was 10. So somewhere between 10 and 20, maybe 30 is the average. There's a delay, obviously, to deaths from cases because that does sometimes take a long time for that to happen with a confirmed case that might have been several weeks earlier. They're testing strong at around 10, 11, even on the weekends, 8,000 tests per day. And these are the molecular tests. These are the swab tests that are showing confirmed cases. So that's a very robust testing regime. Total molecular tests, that's again the swab test administered, has been 1.256 million. All the metrics, this is the metrics from the state, show us in a positive or in progress trend. And I've got another slide later to show you how the county's faring with that. This slide here shows the trends amongst Barnstable County versus the state. Again, the state is at a positive rate of 1.7. That's the positive rate of tests. So 1%, 1.7% in the state are coming back positive. Barnstable County is 1%. And if you look at our death rate is in line with the state or in progress. It's not as low as we'd like to get it. Number of patients in hospitals is declining, so we're in a positive trend with that. Our healthcare system readiness is green here on the Cape and yellow elsewhere. So the hospital, the Cape Cod Healthcare, readiness is better than the state average. Our testing capabilities, our capacity is green as well. And our contact tracing capabilities are better in Barnstable County than they are in the rest of the state, so we're in a positive on that. So that's the Barnstable County's website. That's a new slide that I've included. I just saw the county do that, and it shows that basically Barnstable County is running stronger than the rest of the state in terms of its metrics. Again, looking at the dashboard from the state, we're down 94% from April 15th in our average positive test. We're down at 1.7% positive, which is good. You want to get that lower definitely than 3. Lower than 1 would be even better. So I like to keep seeing that going down. Hospitalizations are down. It's not down, lately it's gone maybe down on average in a given week, maybe 10 to 20 per week. But it is on a downward trend. Surge capacity seems to bounce around, and that also might have to do with hospitals getting back to some sense of normalcy, doing other electives and other types of surgery. Then when COVID patients come in, if their capacity would be less than if they had shut down a whole floor for COVID maybe a couple of months earlier. But that does seem to fluctuate between 1 and 5, 1 and 6. And our death rate continues to decline on a daily basis, and you can see that that trend continues. Hopefully it continues. By county, you can see that Barnstable County has got 1,593 cases since the beginning, and is flat. Dukes and Nantucket, you can see that has had a bit of a blip up as people have gone to the islands for the summer. Mainly flattened out, and it looks like at least in Dukes County on the Vineyard. It's been 66 cases since the 1st of July in all 3 counties combined. This is a new slide. This shows testing and incident rates. On the left is the incident rate. The lower the incident rate, the better. You can see that Falmouth, down in the lower, where Falmouth is, shows that we're on we're lower than a lot of the towns. Not every town, but we're in the lower end of our incidence rate. But if you look to the right, you can see that we're darker, showing that we have a more robust testing rate. So it seems like we're testing higher than the town average, or the state average for towns and cities. So we're testing more and finding less, is what these 2 things indicate. These 2 pictures on the slide indicates, which is encouraging. The more tests we have, and the more of them come back negative, that's what we're looking for. So that shows a pretty good trend, and that's that's the weekly. So when you go on the Mass DPH website, you'll see that there's a daily update. There's also a weekly one that comes out on Wednesdays, and it shows this chart. So I've mixed the daily and the weekly. The weeklies, again, comes out on Wednesday, and then the daily obviously comes out daily by 4. So you can see that chart, these charts evolve, or these maps evolve. As far as residents in isolation due to COVID, the total number of cases since the last time I did the presentation on 7/10 was up 1,167. Release from isolation was 1,043. We had an increase of 124 deaths, and we've dropped as many as we've gained in the total current isolated cases. That number remained unchanged. So we've lost some and gained some throughout the week. This is interesting. This is the confirmed cases and tests performed by city and town. I pulled Falmouth out. Total case count of 206. In the last 14 days, less than 5. We're in a decreasing trend. Total tested was 5,955, with 871 tests performed. And positive last 14 days of 6, and the percent positivity is low at 0.69%. So our 14-day percent positivity is 0.69%. The states is a little under 2 at 1.9%. So we're, again, like it showed in the maps before, it showed that we are testing higher and finding less. So that's exactly what we're looking for, and hopefully that trend continues. Hospitalization, this is the state chart. This is, I think, on the daily. This is on the daily. We're down 242 from June 26, when I started keeping tabs week to week. We currently have 580 in the hospital now. And that trend, there's a couple days here and there that it goes up, and then there's days, most of the time it goes down. We're down 242 over the past 3.5 to 4 weeks. ICU and intubations. Okay, intubation means the vent. So we're down 94 from June 26 and down 61 from June 26 in intubations. Again, trend continues, as I've done in the last, several of their presentations that I do on a weekly basis. All those trends look good. The hospitalizations locally, Falmouth Hospital and Cape Cod Hospital, it varies between usually 3 and 0, 1 and 0. Occasionally goes up a little bit more, but over the last month or so, it's been steady at, when I check that every day, it's 1 to 0. Over the weekend, it was 0. At Falmouth Hospital, it's 1 as of 7/14. As of 7/6, it was 3. So it does fluctuate, and that also means rule out. So somebody who comes in with symptoms may count one day but be negative, and then be released or not the day after. So, or the same day. So that number fluctuates a little bit, but it is much lower than if you went back up into May and saw that we were in the 20s and teens. Again, another good trend. Long-term care facilities are unchanged from last week, so there has not been activities, which is wonderful at our local nursing homes. The death rate among nursing homes remains about 65% of all total deaths are linked to long-term care facilities. Our long-term care facilities had some issues in May, April, May, maybe even to early June, but that has definitely, at least for the most part right now, it remains unchanged and in check. Testing. So COVID-19 testing. I went on the website for the Cape Cod Healthcare. They still have the community college set up, at least as far as their website is concerned. They were going to eventually move that over to the hospital, the Cape Cod Hospital, later this summer. As of June 24th, the drive-through testing is also cited at Falmouth Hospital. You'll need an appointment done by your physician. If they call the dedicated call center at 508-862-5595, and that'll get you the number for Cape Cod Healthcare, which will allow you to get a test set up. There's also available, I think, as far as I've checked recently, at East Falmouth CVS, and then the walk-in clinic that we've got, the Convenient MD. There's also some pop-up sites available in 8 cities, I believe New Bedford being the closest. Some of the cities that were not hitting metrics that the state wanted, they did some pop-up to get some extra testing in those areas. You could also do that. I heard it's going to be till mid-August. Or you can go on the mass.gov COVID-19 testing. You can Google that or whatever your search engine is and find some testing centers that I may not even have listed here. And obviously we're getting tested because you can, from the previous slides, you saw that we have we're doing a fair amount of testing here in Falmouth, and that's great. This slide remains unchanged from last week. We're still in phase 3, step 1, which allowed gyms and fitness centers, museums and historical facilities, some sports, youth and adult sports with guidance, some human services programs, long-term care visitations, though you should contact each long-term care facility to see what their rules are. Casinos, there's very a few others. Gatherings, there's a max of 8 people indoors per 1,000 square feet with a max in any single space of 25. And same with this outdoor regulations as well. Phase 3s will last a lot longer. I'm not sure, we haven't had any indication of when step and what would occur for this step 2 in phase 3. Again, now to carry on with social distancing, we get, I can't count how many complaints we get a week or ask for us to follow up with businesses or in locations where social distancing and face masks is not occurring. We follow up and do the best we can to get to as many as possible. Of course, we still need to have continued diligence because we know that the masks and the social distancing work. And the last thing we want to do is undo the hard work that we've done. So it's important that we continue the diligence with the hand washing, hand sanitizing, stay at home when ill, following the state guidance, and continue diligence. So even though the case counts are very low, we still want to be continuing to do that. You can see, elsewhere in the country they've had spikes. We don't want to have a spike. We definitely don't want to undo. We want to keep our counts where they are and continue to have them get lower and lower and lower. To recap today, very similar to the presentation I gave you last week. The metrics remain low and flat. The cases on the Cape and Falmouth remain low, even though we do have a lot of visitors here. It seems like the data has not indicated issues with that, which is great. Hopefully it continues. We're currently in the state's metrics looking good. We're currently in phase 3, step 1. So that's what I have for the week, and I will see you all next week. Thanks.